Primary ovarian insufficiency. It's also known as premature ovarian failure. Those words are not ones that anyone likes to hear, but they're not the same thing as menopause. I am so excited to get to talk to Dr. Serena Chen about this particular topic. I think there's a lot of truth, fiction, misleading things that we need to clear up today. Serena, thanks for joining. Always great to see you.
Thanks for having me.
So let's dive right in.
Okay.
Primary ovarian insufficiency, POI. It's not menopause, but why does it feel like it's a menopause?
They used to call it premature menopause or premature ovarian failure, which are both kind of like negative connotations and a little bit misleading, but have some overlap with some characteristics of menopause, because a lot of people with POI times have very high FSH levels. And what we see in menopause is, as you run out of eggs and you hit that normal age of menopause, average of 51, your FSH goes up, your estrogen goes down, and then you lose your periods for a year. And that's the diagnosis of menopause. And the FSH goes up because your brain is trying to tell your ovaries to make eggs and to make estrogen. And when the ovaries don't respond, then your brain keeps putting out more and more FSH. So that keeps going up. And a lot of people with POI will present with irregular periods and a high FSH, a low estradiol, and then even some characteristics like hot flushes, which we associate with menopause, but are a result of big hormonal fluctuations and not necessarily pathognomonic or diagnostic of menopause. They're just a characteristic that can be associated with low estrogen. So, and premature ovarian failure, I guess, is saying that the lack of periods. So there's three kinds of lack of periods besides pregnancy. One is PCOS, which is just the hormones are there, but they're not coordinated. There's hypothalamic amenorrhea, where your brain doesn't make FSH. And then there's primary ovarian insufficiency, where it's the ovaries that are causing the lack of periods. So we have, different parts of our bodies that coordinate together to make people have periods. And it depends on what part is not working, what we call it.
Now, when you get this particular diagnosis, though, and you're a young woman, can you still get pregnant with your own eggs? Do you have eggs?
So that's the thing, is premature ovarian insufficiency is a much better name for this condition than premature menopause, because menopause is permanent. Whereas if you have premature ovarian insufficiency, that means you're having some of these characteristics before age 40. And the younger you are, the more likely you are to be able to get pregnant, but it definitely is harder. So if you take big numbers or like big studies, it's hard to be precise, because it's not well studied. But in general, we think the overall pregnancy rate for somebody with premature ovarian insufficiency is like 10% overall, whereas we feel like somebody, just anybody from the general population without ovarian insufficiency has more like an 80-85% pregnancy rate. So that's like an overall pregnancy rate, overall prognosis, not a per cycle pregnancy rate. So
that's very, very different. So I imagine that diagnosis can feel very devastating.
Yes, it certainly can, but I definitely feel like it's wrong to tell somebody there's no way you can get pregnant on your own, because it's just not true, especially if you're under 35. So age does make a difference. And, if somebody's in their 20s and they're experiencing hot flushes, lack of periods, a high FSH, a low AMH, I'm definitely concerned about them. But I think we can't say, oh, you're never going to get pregnant on your own, because some of these people do.
Right.
Does that make
Now,
sense?
yeah, it makes complete sense. Now, what about the causes though? Because this is also something that it's difficult to determine the exact cause. So what are a few things that may actually lead to this?
It could be, a lot of cases, we don't have an explanation. So a lot of cases we call idiopathic and we don't have an explanation. And we think perhaps there are genes that somebody inherits that could be causing this, and we just don't understand it well. Common things are surgery on the ovaries, like if you get your ovaries removed, or you get one ovary removed, or you get endometriosis damaging the ovaries, and then surgery. The removal of eggs, the removal of too much ovarian tissue could cause iatrogenic premature ovarian insufficiency. Chemotherapy and radiation can cause ovarian insufficiency, which is why we like to freeze eggs before chemotherapy and radiation for cancer. Heavy smoking can definitely cause diminished ovarian reserve and cause you to go through ovarian failure or menopause earlier. And fragile X carriers tend to have a higher rate of premature or earlier menopause or premature ovarian insufficiency. And BRCA patients, people that carry the BRCA gene, might also be at slightly increased risk for this.
That's really interesting about BRCA. I saw when I was working in an onco fertility center, I saw a difference in BRCA1 versus BRCA2 egg retrieval numbers.
Yeah, which is interesting. We still don't know a lot about it. But we definitely see, in general, cancer patients tend to produce less eggs than we expect them to. And there definitely seems to be an association between BRCA and ovarian reserve. And there's still so much that we don't know. And is this a direct ovarian effect? With BRCA, you think it might be because, they have that increased ovarian cancer risk. But the general thing of all cancer patients might be just like those patients are ill and therefore don't respond well, to the ovarian stimulation. It's hard to really know. And then of course, if you have a family history of going through ovarian failure early, or stopping your periods early, or menopause early, like your mom and your sister, or your aunt, like close female relatives, then it definitely increases your risk. Like people tend to go through menopause around a similar time as their mother went through menopause. So we do feel like there's some genetic component to the age of menopause.
Got it. This is so fascinating to me. Do you see any evidence, even if it's just anecdotal, of when someone begins their period and an association with?
No, we don't really see that.
So everybody just has normal cycles until they don't.
Yeah, that's what it seems like. Because people are always asking that, but it's not. I don't think it's easy. I don't think there's a definite pattern there.
It's so interesting, because it would be a lot easier if there was a pattern, because then maybe you would know about it sooner, and then people could be more proactive with egg freezing earlier.
Well, that's the thing. Like if somebody knew, yes, I'm in that 10% group where I have a good chance that I might get pregnant, other than age. So if we say the younger you are, if you're experiencing this premature ovarian insufficiency, the more erratic your ovarian function is, and the more likely it is that you could get pregnant. Other than age, that's the only thing I have to hang on to. Everybody else, it's like, well, you might get pregnant, but you might be, in that 90% category of people that just can't get pregnant without help, like donor egg or something like that.
Now, Aside from that, though, there's bound to be other side effects, though, if you really have this insufficiency, even though it's not
Yes.
cause menopause, because you don't have the normal levels of hormone for your age. So
Yes.
how do
Yeah.
you?
So you could have, hot flushes can be really terrible. They seem just inconvenient, but they literally just completely and totally disrupt sleep, which is a huge risk factor for heart disease and diabetes and things like that. So disrupting sleep is a serious health consequence. The other thing is if you have chronically low estrogen, then it really affects your bones. So you're at high risk for osteoporosis and fractures and kyphosis and things like that. And it's very, very important to address that early, because once you lose bone, it's very, very difficult to build it back, even with some of these
Right.
fancy drugs that are out there, which themselves have a lot of side effects. Um, so protecting your bones and making sure you have enough estrogen for your bones is very important. And then because premature ovarian insufficiency can go in and out of ovulation, so you could sometimes have really low estrogen, but sometimes rise up, but not have a regular ovulatory cycle. That often means that a lot of people are doing this thing where they have too much estrogen and they don't balance their progesterone, which is a risk factor for cancer of the lining of the uterus and hyperplasia and things like that. So um, those are, I think, three of the biggest things. Then there's all the other things that estrogen can affect. It can affect your cognitive function. It potentially can affect your cardiovascular health. It can affect the thickness of your vagina and the strength of your vagina and your bladder tissues. So that could make you more prone to vaginal pain, discomfort with intercourse, bacterial vaginosis, other infections, bladder infections, things like that. So estrogen affects every single bone in the body or every single tissue in the body. Even in men, we think estrogen is really important for men's bone health. So it is an important general health issue. Even if you have no desire to think about having kids, it's a serious health issue and needs to be addressed.
Now, people will see you, though, when it comes time to do IVF or to do IVF with donor eggs so they can have their family. Who sees these people throughout their life because of those types of side
We
effects?
see a lot of those people. I think that because we spend a lot of time doing hormones and that's like something that we deal with on such a
Mhm.
regular basis. A lot of people do see us. A lot of people see their OBGYN. Their OBGYN can help them address all the cancer risks, help them with hormone replacement, help them figure a lot of basic things out. Medical endocrinologists might be able to help as well. And there's no hard and fast rules. I think it's important to find somebody who is that you feel comfortable with and who's going to address your symptoms. And
Right.
obviously you guys through the platform help people find somebody that's in their local area, which is great.
Yes, I just need to know what type of specialist to look for, and then we
Yeah.
can do it.
Yeah.
That's the trickiest part. I mean, I think that this is a really heavy diagnosis. It's kind of filled with similar to PCOS in the sense that this is for the rest of your life,
Yes.
and that it can lead to health outcomes that are undesirable. And so it's really important in that scenario to be very proactive in
Yes.
making sure that you do get to the right place, but that having a family is still possible. It is
Yes.
not a sentence, if you will. And that, certainly finding the right provider at the right time is really mission critical. And this is why we advocate for people to know their AMH levels, know their hormones very early on in life so that they have data about themselves throughout their own life and can make proactive decisions.
Yeah.
Because if they do start to see things go down prematurely, then of course we would also help them identify a great egg freezing specialist in their area so that they could access fertility
Yes.
preservation options
Exactly.
too.
So yeah, I do see some patients that are coming in where you know, they have irregular periods and a low AMH, and even at a very young age, you know, if they're at risk for diminished ovarian reserve or premature ovarian insufficiency, POI, egg freezing is definitely something that, you know, could possibly be considered in some cases. So.
Perfect. I love it. Well, we are going to start interacting with some of our users and our patient population on Instagram Live next week.
Yay!
So we will start to see everybody on Mondays at 2 p.m. Eastern, 2 p.m. Pacific, 5 p.m. Eastern.
Yep.
Get my time zones right. All questions are on the table. We're here just to have a great dialogue about everything related to fertility and be your motivation Monday. Thank you so much, Serena. I'm Alice Crisci, your co-host, and this is your Fertility Answers platform. We'll see you on the app on iOS and Android, or we'll see you on Facebook, Instagram, or YouTube, wherever you might find us. Like us, share us, keep the love going, and thanks so much. We'll see everybody next time. Bye.
Bye.